Hello, my name is Dr. Dawn Heiman and I'm an audiologist. Many people in this world suffer from tinnitus. My sister and my father individually recently came to me with questions about tinnitus. And you might say, well, what's tinnitus? Tinnitus is anything that you hear that doesn't have an external stimulus, meaning that you could hear sounds in your own head that doesn't have a sound outside the world. Everyone else isn't hearing it. So you could be hearing a hissing, you can hear a whoosh that's repeating, you can hear a constant high-pitched ee, you could hear, some people say cicadas or a humming, different sounds that you hear in your ear. I have tinnitus. I usually hear it in quiet. Just like my father and my sister, they had the exact same story as I have. They tend to hear it when they lay down to go to sleep, but it doesn't seem to bother them. It's not there very often, but sometimes even when there's noise, they can hear it really loud. Most people hear it somewhere in the center, and it is the brain that is picking up sounds within our head. Or your brain could be creating these phantom sounds. If it's sudden and in one ear and it's really bothering you, you need to have your hearing tested immediately, especially if there's been a change in your hearing. There is a chance that you have a sudden sensorineural hearing loss that needs to be looked at. There's a chance you have an ear infection. So you need to make an appointment with an audiologist, and then they will then refer you to the specific providers who can treat it appropriately. But we first would need to decide what type and degree of hearing loss there is, if there is one. A lot of people have normal hearing, but they're hearing some kind of sounds in their inner ear. And it can be from a change in the pressure of their ears. It could be from years of listening to loud music. It could be from a medication that you're taking. There are many different reasons why people have it. It is something that you should discuss with your healthcare provider, your primary doctor. You should see an audiologist to have an evaluation. And we have treatment methods to help people to move forward from it. There's no cure for tinnitus, just like there isn't a cure for diabetes and heart disease. It can be chronic, but there are ways to manage it so that you can just move forward with your life. So I really hope that you have an evaluation by an audiologist for a tinnitus evaluation if it is bothering you, because there are behavioral treatment methods that we have, and we also have instruments and tools and things like that you can use to manage it. So you can just move on with your life and say, do I have tinnitus? Yep, there it is. But it doesn't bother me. I hope you're having a great day. Ask me questions below if you have any. Feel free to call our office, and we'll just go from there. Thank you. Bye-bye.